My name is Fombi Afolayo. I'm a registered nurse here at Rogers Behavioral Health on the Child and Adolescent Unit. Working as a mental health nurse is very different because when our patients come to us, they are in crisis. Usually it's a mental crisis. They're physically stable, medically stable. But our focus is how to walk through that crisis with them, how to support them through that journey. So a typical day looks like coming in and working with the rest of the nurses that you're working with to determine who does what and who takes what patients. When this is done, I go on to assess my patients physically and mentally to determine what they need, what I need to be attending to right away. I work collaboratively with the psychiatrists, the therapists, and sometimes dietitians to determine what our patients need, develop a plan of care, who's getting admitted and who's getting discharged, what level of care are they being discharged to, and also communicating with parents or guardians regarding the plan of care for patients. I review labs, vital signs, we administer medication, and we assess for effectiveness of those medications as well as side effects. Computers are a big part of this work. We use electronic health records to have access to patient charts. We also use the computer to communicate among the care team because then we can respond to things more promptly. We do a lot of moving around. However, what's really unique about this kind of work is other than having to walk around, sometimes sit on the ground with your patients, especially when you're working with kids. Other than that, it's not anything strenuous. That's really, really nice. One of the challenges of working as a mental health nurse is the unpredictability of situations. Sometimes you never know what can happen. Because every day is different. A patient is stable one minute and the next minute they're in crisis. However, what is really amazing about working in a place like this is I work with a really great team and I always have resources at hand. Everyone has we all have different level of experiences. Some people have worked here for a very long time, and with that comes a wealth of knowledge that they come with in how we de-escalate patients and how we make these kind of situations better. I used to work as a bedside nurse in a medical hospital, and making the switch over to work at Rogers Behavioral Health has completely changed my life. It was a chance I took at a different kind of nursing career, and I didn't anticipate that I would be the kind of person that I am. It's truly amazing to see what happens to you when you work in a place that is committed to making the lives of people better, and you work with people who truly care about what they're doing. It's extremely contagious. You really honestly just want to be a better person because everybody that you work with, you see how vested they are in the lives of the patients that they care for. And the longevity, the amount of years they've worked here for tells a lot. And I come to work every day and I just want to be a better person. I'm learning skills that are helping me even in my personal life to communicate with people properly, to be a therapeutic presence to people, and to be more empathetic and compassionate to people. This job literally has changed my life.